of Uganda Family TV. My name is Bruno Edgar Tumuhere. Thank you for joining us this 16th of January 2023. Now, as always, Issues at Hand is proudly brought to you by Protea Hotel Entebbe. The year has begun in earnest and with so much preparations for the year when it comes to organizations, individuals, as a family. I know many of us have the plan to have conferences, for instance. So Protea Hotel Entebbe is the place to be when it comes to having those conferences. Then for those of you, for example, Mahoro, who are planning to get married, you can have your reception there as well. So make your reservation and booking today. The number is on the screen, so ensure that you call that number and get your experience at Protea Hotel Entebbe started. Now, on Issues at Hand today, we have an interesting discussion about the right of health workers, and we have come to see that the plight of health workers is very important following what happened during the Ebola outbreak and what happened during the COVID-19 pandemic. We saw a lot of health workers were put to task to fight these outbreaks, and in some scenarios we saw that some health workers were not given enough protective equipment, and unfortunately there are some health workers who succumbed to these diseases, which is something that should not be the case, because health workers are our frontline soldiers to attack and fend off these diseases, but it is sad when they are lost in the fight, especially due to incompetence as far as government or as a population is concerned when it comes to protecting those who are fighting hard to ensure that our lives are safe. So that's why we're having this discussion this morning, and with me to have this discussion is Tracy Rita Achola, who is a lawyer in the Strategic Litigation Department at the Center for Health, Human Rights and Development, also known as Cehurd. Welcome to Issues at Hand this morning.
Thank you, Edwin. Good morning.
Good morning. And you can start by telling us what exactly Cehurd does.
Okay, the Center for Health, Human Rights and Development is a not-for-profit organization which was founded in 2010, and it's basically pioneering the justiciability in health, the right to health, and everything that pertains to health. And it's in Gayaza, Nakwero. So we basically use the law, policy engagements to inform our decisions and our advocacy out there. Yes.
Wonderful. And later on we shall get into what Cehurd is doing when it comes to enforcing the rights of health workers here in Uganda. But let's first break down who is a health worker and what are some of the rights of health workers that are important for us to know.
Thank you. A health worker is basically that person who is there to ensure that our well-being as human beings is okay when we go to them, and they're the frontline workers. They make sure that we are okay. And their rights are really well spelled out by the World Health Organization, by the international labor laws, and these, unfortunately, we might be here and most of them do not know their rights. But they have a number of rights. One includes, when it comes to safety and organizational, because we're talking about policy and the recent Ebola pandemic, it all goes back to their safety and occupational health when it comes to these pandemics. You know, they are the frontline workers. And them being the frontline workers, it's very pertinent that they go through so many psychological issues, mental breakdowns, fatigue. But at the end of the day, who is there to watch out for the health worker? Because we know that the health worker, you'll never see a face of a health worker on TV saying, oh, my rights, my rights, my rights. Everyone assumes they should be the ones that work. I mean, they are human and they work. So basically, they have a right to have breaks and good working conditions. Like a normal person would work 8 to 5. The health worker also has that right to do 8 to 5 or 9 to 5 and rest. ideally, if you don't rest as a human being, there is that famous saying of, if you do not rest, the body will find rest for you. So you'll find that most health workers will deliver, but not to our expectation because of working extra hours.
On that point, before you continue, something that we'll say to that in rebuttal is, well, when it comes to the Ebola outbreak, for instance, you will understand why a lot of health workers had to put in an extra shift when it comes to working, because it's something that went out of hand at the beginning of the outbreak. And so the question then is there an avenue, for instance? Is it that they are also entitled to have these breaks, or because of the industry and the special nature of certain situations like outbreaks, they are they can put in extra shifts, but there's something that comes in a way of compensating that shift that they're putting in?
When it comes to them working extra shifts and doing all that, I think it all goes back to the issue of them being understaffed. You know, many health workers tend to run away from this industry, especially in Uganda. You realize there is a time most of them were leaving the country to go and look for greener pastures, because maybe the pay out of this country is good, so they have no option but to go. But when someone really works extra hours, they are entitled to that extra pay, let's say extra pay. It's not really compensation. Compensation is something else, yeah? But they are understaffed. And when someone is understaffed, you have like a ratio of 2 to, let's say, 50 patients. Or one doctor or one nurse, midwife, whatever, handling over 50 patients. And that kind of brings some mental fatigue and psychological distress to the health worker. And that's why I'm saying they have a right to have these breaks, but to what end? They are understaffed. So it will push them to work the extra hours, and no one is considering that, oh, this health worker actually has to rest, but how should they rest? People will die, because it's like, let's say 2-3 of them in a hospital that has so many patients coming in. Yes.
Definitely. That's a very interesting, and we hope that the powers that be listening to that fact that there is need for more staff when it comes to health workers. What other rights are they due as far as the law is concerned?
Yeah, they have a right to be provided with these with adequate PPE materials. I think it was during COVID and this recent Ebola pandemic where the health workers were crying out that they don't have enough protective gear. Now, when a health worker doesn't have protective gear, their risk of getting this virus is very high, because one, they are touching these things, they are in contact with these body fluids. It's Ebola that is transmitted through body fluids, touch and all. COVID, the same. I think it was the same for COVID-19. So when they don't have enough adequate gear, which is their right because they are doing the work to save our dear lives and the lives of all the Ugandans out there, it becomes a violation to them. And this can put them at risk of death and contracting the disease. Of course, these health workers have families out there. Remember, they do not go back home to their families. They are in that space. They are interacting with so many patients of this disease, and then they'll also come out and cry, oh, we don't have enough PPEs. So that was a gross violation of their right, I should say, because someone who is doing this work for us should be given everything to make their work easier, more like morale boosting. But they are also working in fear of, even if I was to deliver my best, I don't have enough PPEs. How if I touch that patient? So they'll be laid back a bit. Yeah. And
they'll not give the required treatment that's needed to the best of their ability.
Yes, please.
Apart from those two, are there any other?
Yeah, health workers really have a variety of rights. There's also that of them not, when a health worker comes to you outrightly and tells you, I don't think I want to work or do this because I could be exposed my health, the health worker is entitled to that right. Unfortunately, most of them will be threatened. Why don't you want to work? This and this. Your jobs will be at risk. But maybe they have an underlying health condition. They are not putting out there because, like anything else, health is confidential to the person. Like they feel it's them that should know their issues. So when a health worker comes to, let's say, a supervisor or head of the facility and tells them, unfortunately, I can't be in this fight of COVID-19 or Ebola, they shouldn't be threatened. Like, why aren't you going to work? Why aren't you going to do this? They should be given that exclusivity of it is okay if it's okay if you're not going to do this, and of course pay them.
But you do understand, again, on the side of the employer, which is government, that unfortunately, when an outbreak like Ebola comes in or COVID-19 comes in, it is hard to then understand if a health worker does not want to work because the country needs those health workers very urgently since lives are at stake.
Yeah, the country needs them, but what if I have an underlying health condition? Me being a health worker does not necessarily mean I am good health-wise. They are also battling health conditions that, of course, they can't come out to say. You get. So when they say I'm unfortunately I can't be able to be on this frontline battle because of this and this, the World Health Organization spelled out guidelines. It actually talked about the rights of health workers that should be respected during the COVID-19 battle, and one of them was a health worker being able to excuse themselves in case they see a threat to their health or to anyone else around them. They should be excused not to work, and of course not threatening them that if you don't do this and that. So they have that right to, just like anyone else has a right to say, unfortunately that also applies to the health workers. Like I said before, they are human like us. They deserve every other right, but there's a way Ugandans hold them in this thing of health workers, they shouldn't rest. They should be there to serve us all the time, which I think should change as a mindset. And also, let's say in a hospital, there's been a risk. The health worker has a right not to return until that place has been, let's say, there have been remedial actions taken in that place. They have no right to return, because what if they return and contract the disease from there, the virus, whatever, from there? So they have that right as well to be like, know what? This, until you guys clean that place, you people clean that place, then I'll be able to step in.
Definitely, and the reason why we're having this discussion is recently, for instance, the staff at Uganda Cancer Institute were on strike as well because they had concerns that maybe at the time were not being listened to. But as well, during the Ebola outbreak, we saw that we had Uganda Medical Association talking about how health workers did not have enough protective equipment. We also saw later on the medical interns talking about how they were going to lay down their tools because they were not given appropriate allowances. So those issues have seen a lot of start-stop in as far as delivery of health services is concerned in Uganda, and that's why we're having this discussion. So on that note, now that we know some of the rights that you have shared with us when it comes to health workers, what are the issues that are affecting them as it stands currently?
One of the major issues affecting the health workers is them being understaffed. Health workers are really understaffed in this country, and it will surprise you that we have so many doctors, midwives, nurses graduating each year. But you ask yourself, when these things come up, where are they? They are few, they are understaffed. There is one in Soroti, midwife. This is not in relation to Ebola or or COVID-19, but of course it speaks to the health workers. She was one, and she would deliver about 50 mothers per day. Now, think about how she would her rest at night. Do you think that lady was getting enough rest, really? Because of the issue of them being understaffed, they tend to have a very heavy workload on them. You have to meet patient expectations. With these elite patients these days, you will not attend to one, and the next thing they are reporting your job is being threatened. So them being understaffed is a very, very big health issue, a very big issue that they are grappling with. And also the issue of drug stockouts.
What do you mean by that?
Drug stockouts is drugs not being in stock. Are we at par?
Yes.
Yes. So let's say a patient goes to the health facility. They know this is a government facility. Everything is free of charge. But they will, a medical personnel will write to them a note saying you have to go buy these drugs there at this amount. Now, with the way everyone tends to demonize the health workers in public facilities by saying that you health workers are corrupt, you ask patients for money, patients can't be able to access health facility, health related, patients can't be able to access health services because you ask them for money, you are corrupt. And it will surprise you that they are actually honest. Some drugs are not in stock. And how do you expect a person who is demonized in the public to be respected by a patient? The patient will walk in and say, "Doctor, I don't have money, but you've told me to buy these." Those are the issues where you have patients being violent towards the health workers. Like, you have the money, sorry, you have the drugs, why aren't you giving them to us? So it's the public that demonizes our health workers, that even when these patients go to the facilities, they expect to find drugs in stock. That even when these drugs are not in stock, no one will believe them. They'll be like, "Why do you want us to buy these drugs?" For a patient, let's say in a rural setting, who has walked 20 to 10 kilometers, because they don't have like 5,000 to buy this particular drug, and then they walk to a government facility expecting to find this drug. Unfortunately, it's not there. And it's the doctor telling them, or the nurse, "Go and buy this drug." And they've already had these stories of health workers are demonized. Sorry, health workers are corrupt. They want money on top of them being paid salaries. So I think also, as the public, there is a way we should accord respect to these health workers, even when addressing these issues in public. You don't just come out and say, "Health workers, you are corrupt." To what end?
But also, and outside some of the claims that people have of corruption, something that a lot of people have an issue with when it comes to health workers is the fact that in some hospitals, for instance, the health workers look like they are slow to do their job. A good example is, I went to a certain hospital. I went there at 9 a.m. and I came out of there at 4 p.m. and a lot of the health workers were dragging their heels. And so I think that's why sometimes a public perception of health workers is not so good, because some of their experiences have not been adequate in terms of service delivery from health workers.
Of course, like every professional body, we all have a code of conduct that governs us. So for health workers, it's a code of ethics, professional conduct, something that governs their body, how they are supposed to conduct themselves and how they are supposed to treat patients when they walk in. Of course, they are supposed to treat with, because they I'm sure they swear something like an allegiance to serve patients regardless.
What some people call the hypocritic oath.
Yeah, the hypocritic. Yeah, hypocritic oath, but it's an allegiance that they swear to serve us regardless of what condition, regardless of. So I think for a situation like that, they have their bodies that govern them, where we could report like this hospital, this and that. Yeah, because they have that governing body, and code of ethics conduct. But if it was a public facility, like I said before, it could be an issue of fatigue. I worked overnight, and then I have to work the entire day. If you don't find rest for your body, the body will find rest for you. And this is usually shown in their attitudes, like, I am tired, you're also coming with this. It's, of course, them having that attitude towards patients is not a good thing. It demoralizes the patients. As a health worker, you are supposed to be enthusiastic towards your patients. You're supposed to give us hope when we see you. We see you, we see a doctor, we see hope. We are like, yes. And how they will do their things, they should be quick, efficient in their service delivery, because we are talking about health, someone's life.
Yes, and it's for many, it's a matter of life and death. And so, what is your say on what can be done when it comes to changing the public's perceptions of many of our health workers?
I think this should be an issue of having multiple community engagements with the public. You have to tell them. But still, even when you do this, we shall still go back to hospitals and there will be a drug stockouts of a particular drug. And still the person will come and say, I think the doctor is being corrupt. But then also health workers, let's go back to the issue of rights. They have a right to these refresher trainings, these courses, like they have to keep up to date, like this, with these trainings and changes in their fields, because changes are constant. It's the only thing that is constant in life. So they have to keep going through these trainings to tell them about the different trends that are really happening, because some are still archaic. They are conservative to what they learned 20-30 years ago. Yes, and also of course, you can't change a community perspective on something. When someone says this and this is this, it's hard to change some mindsets. But of course, time reveals everything, I should say. And
time heals all wounds, like some say. And then, what other issues do health workers in Uganda have to grapple with?
The issue of course, they talk about poor living conditions. It's not even talking about, poor living conditions. Their staff quarters, underpayment or delay in salaries. You've realized that health workers always have these strikes where they threaten to lay down their tools because they have not been paid. It's a very big issue, because that payment should be their motivation. Even though, however little, it should be their motivation and it should come on time. So when you talk about having to give them late pay, then going 6 months without pay, that's, I think, for the medical interns who want an increase in salary in their facilitation. So that's a very big issue that they grapple with. Yes.
Yeah, and these issues now, because it's important for us to understand the idea of cause and effect. Now, if these issues continue to derail the enforcement of rights of health workers, what would be the effect on us as Ugandans?
That could be a long-term effect. When health workers lay down their tools, you see how many lives are lost. So many lives are lost because they lay down their tools, and not every Ugandan can afford a private facility. So our hope as Ugandans is in the public facilities with these doctors of ours that are they are not happy. They are grumpy, little pay, poor working conditions. They work extra hours. No one is actually looking out for them. Their mental health, psychological health is in danger. So we shall. I don't want to say this because I don't think it will happen, because we still have some passionate health workers who will go regardless. So I think some will lay down their tools. We shall see them leaving the country. They usually go to Trinidad and Tobago, Cuba. That's where Ugandans got the famous Cuba doctors, something like that. They go, of course, they'll keep saying they'll bring, but that's where most of them go to find greener pastures, because maybe there they are paid well and they respect their living conditions. Also, it's a right to health for someone to live well in clear living conditions, clean living conditions. Yes.
And on the issue of salaries, we saw that being a big issue, salaries and allowances. What do you think is the way forward for this? Because as it stands, government is strapped for cash and they can't seem to operate at a maximum capacity. So as it stands, do you think that there are other avenues through which these allowances and salaries can be increased? Or will they have to wait, like government keeps saying, wait, when things get better, we shall increase the salaries?
Maybe things will get better one day. All hope is not lost. All hope is not lost. I think the issue of their salaries, it should be the Ministry of Health through these policy changes and maybe different civil society organizations, advocacy, to ensure that the health workers are having good working conditions. Of course, having a good facilitation or salary is also part of a good working condition. Yeah, maybe through these informed policy changes, advocacy, government could look into it. Sorry, I beg your pardon for that.
Definitely, and we shall talk about what government should do to make to enforce these rights later on. So, in your expert opinion, what are some of the lessons that we have learned as far as the rights of health workers from both the Ebola outbreak and the COVID-19 pandemic?
In regards to the health worker rights, we have to be ready as a country. Of course, COVID-19 is still going on, I should say. Ebola first surfaced in 1976, is it? September. And it has had 29 occurrences. Since then, it has had 29 occurrences. That means it is something, it's a pandemic that comes and goes. It comes and goes. So in this, I think we have to always be prepared. Our health workers always have to be prepared. And in regards to their rights, the PPEs are very important when it comes to these pandemics to reduce the risk for them of having to get these viruses and these diseases, because they are in their line of duty. Yes, and I think also the blame game. When a health worker comes to, let's say, the employer and says, I have been facing this, it shouldn't be a blame game of you health workers you're always up for any strike, you're always ready to lay down your tools. They should be listened to. Because it seems where we are going, these pandemics will keep reoccurring. Like I've just said, Ebola has reoccurred for the 29th time now, from 1976. And how do we curb this, especially with our grappling health facilities? It's something that needs mental preparation and physical preparation. I think the health workers need to be morale boosted, because it's not like it will go. Even if World Health Organization has declared Uganda Ebola free, there are still very many lessons there for government to pick and put to the health workers and the Ministry of Health.
I think one of the things that we can learn is it goes to show that the health workers are good at the job they do, because for Uganda to be declared Ebola free this quickly after the outbreak started in September, it is
5
good
months.
to see. Yes, it's good to see that the health workers have been working really hard to ensure that that the outbreak did not become worse than it was. And when it comes to lessons, something that we have seen is, unfortunately, there are health workers that perished from as a result of being on the front line when it came to the fight against Ebola. What do you think we can learn from that in terms of protecting health workers from being victims of doing their job?
All health workers have a right to compensation. I didn't mention that earlier, but they have a right to compensation. It's also in the international labor laws, and in Uganda, I think it's the Workers' Compensation Act. How someone is supposed to be compensated, especially when they incur something or die at their line of duty. This should apply to the health workers too. The ones that died, you said, I hope their families were compensated heftily, because how are they supposed to continue living when their sole breadwinner is gone? So it becomes also demoralizing to the rest of the health workers, especially when your colleague you are working with dies. It's not something that you can take in easily, because anytime you're thinking we have inadequate PPEs, what happens if I interface with a patient? That puts me at a high risk as well. I could die. So it demoralizes them. And I think we should call upon the Ministry of Health to make sure that these health workers have adequate PPEs. That's very, very important. Because without that, then their lives are at risk. They will continue to interface with these viruses so much, and they will definitely have to go one by one like that.
And the issue of compensation actually still has it's still an issue even from the COVID-19 pandemic, because there are a lot of health workers who have been saying that they were not compensated after all the work they did, especially even those who were deprived, especially families that were deprived of the breadwinners who were in the front line against COVID-19. So that's a very important point. When it comes to the organization, as far as health workers are concerned, maybe this is a question that we have to ask. We've seen different bodies rise up and say, Uganda Medical Association, the medical interns rise up and complain about the same issues with the same employer. So is there something that has to be said of the fact that there needs to be more organization when it comes to health workers? Are they that united? Are they, for example, when it comes to outbreaks, was it a scattergun or approach, or were they ready, one, to tackle the outbreak at that time, but two, also to as they're on the front line working, saving lives, were there people who as a unit were behind them, saying, as we are fighting this outbreak, we are also reminding the Ministry of Health and government and all the stakeholders about your rights, especially when it comes to certain things like the Ebola outbreak?
Yeah, health workers have a body that governs them. That's the Uganda Medical Association. It's an umbrella body that brings together all these medical workers. And they have a leader, and I think they make informed decisions that will affect, in a way, all the other health workers. They protect their own. And we've seen this body grow strong because they are able to come out and speak about the poor working conditions of the health workers, the understaffed health workers, them being underpaid. We've seen them lay down their tools as a body, like UMA president today will. As health workers, we are laying down our tools. So it is that body still that that goes ahead and advocates for these issues that health workers are grappling with through their president. Yes.
Oh, definitely, and that's good to see. And we hope that this year things will be different when it comes to the plight of health workers. And towards that, when it comes to making sure that things are different, of course, we have to ask ourselves, what now is the solution? What is the solution as far as the Ministry of Health is concerned? What is the solution as far as different stakeholders are concerned? For instance, what is Cehurd doing to help the enforcement of these rights? And the rights of health workers are one, protected, and two, enforced. And with me to as we are discussing about this issue with Tracy Rita Achola, who is a lawyer in the Strategic Litigation Department at the Center for Health, Human Rights and Development. And now, Ms. Rita, we shall start from there. What is the Center for Health, Human Rights and Development doing when it comes to one, protecting the rights of health workers in Uganda, and two, enforcing those same rights?
The Center for Health, Human Rights and Development, as I said earlier, does advocacy through informing policy, informing policy changes, like advocating for policy changes in a particular area when need arises. And for this, we encourage government and Ministry of Health particularly to develop health and policy, occupational health laws and programs that will protect health workers from future occupational health hazards. And this could be simply by appointing a health occupational safety officer in these hospitals or ministries that will be there particularly to make sure that the workers the workers' well-being and safety at workplaces is top notch. And in case of anything that needs urgent attention, that officer will be responsible to report such issues so that there is an urgent intervention. You see, when there are policies and programs in place that are effectively implemented, especially when it comes to our health workers, then we shall see less occupational hazards at work and high risks. And this will take me back to the PPEs. This person will make sure that these are adequate and the health workers are well trained on how to use them. Yes. Now,
I do believe, like you have mentioned, Cehurd is doing amazing things when it comes to ensuring that the rights of health workers are duly enforced. But on that note, when it comes to advocacy for policy change, is that enough? Because we have seen that as much as we may have the policies in place, the implementation really sometimes does not come to fruition.
Yeah, we have had some fruits out of these policy changes, and it's particularly goes to COVID, not to health workers in particular. Of course, even to health workers, like, you advocate for them to have these PPEs, and we've seen the government and Ministry of Health really come out and provide them with these. And not to divert you from the issue of health workers, we also have a COVID-19 case that got immediate fruit out of it. Then we also have our petition 16 maternal death case that has also seen government come out to implement the things that were said in court. So there is always hope. Even when you do advocacy for policy change, there is hope. There is always light at the tunnel. Even if it won't happen immediately, we know that when we keep advocating for these policy changes, we shall have fruit. Like, one of our strategies is also having groundbreaking strategic litigation cases, like I mentioned earlier. And we have a number of them where we have achieved a lot, because we have to call out the government or particular ministry to come out and implement or enforce what the court has said. So it won't happen in one day. Let's say I wake up today and I start making noise, not necessarily noise, but organized noise, a light noise about a particular issue. I know that the government will hear, the ministry will hear, and there will be change. It will be effected regardless.
Talking about the Ministry of Health, what would you like to see them do when it comes to the plight of health workers and their rights?
I think it should move away from the blame game. No health worker will wake up and do what they're doing or lay down their tools if the ministry is doing all they can to support them. It's usually a blame game kind of situation. The health workers are laying down their tools. Okay, when you lay down your tools, we shall not give you your job. It's also not it's not listening to someone. So I think the ministry should have an avenue, of course, through the Uganda Medical Association, where this the plight of health workers is addressed and listened to. They should find a common ground where they address these issues, because the strikes are not going to end today. Believe me, we could be here and they are planning a strike next week.
Do you think that those strikes are fruitful though? Because like you've said, there seems to be no movement when it comes to either side in terms of budging, because like you've said, it's always a back and forth. Government, you didn't supply enough PPEs, then the government saying we supplied enough, they're not used well, and there's this back and forth which in the end is not very fruitful. So strikes really that effective on getting government to implement these policies that will help enforce the rights of health workers?
These strikes only yield fruit when we start to see that, because the medical doctors laid down their tools, the medical personnel laid down their tools, people are dying. Then you'll find something. The government will come out, or the minister, and say something like, "We are going to pay. Kindly get back to work." But to what end? Is it always going to be we are going to pay, get back to work? To what end? What is the end goal of this? I think the strikes should also have a goal. What are you trying to achieve? Because if they come and talk to you like, "Oh, we are going to give you this, we shall pay within this particular period of time," it doesn't yield much. Also, back to the issue of PPEs, because we are talking about COVID-19 and Ebola, they always have to be sufficient PPEs, and they have to train the health workers on how to use them, regardless, because without these PPEs, then we are only going to save the patients of these diseases, but we are not trying to help the health workers who are at high risk, because they are interfacing with them at all times. So they have to be trained. The PPEs have to be sufficient at all times. And also to the Ugandans, to the ministry, I think the vaccines should be readily available. Now that they have approved the Ebola vaccine, it shouldn't only be limited to a particular group of people. Let's say the ones above 49, the ones above 60. They should always be in adequate supply. They should ensure that these vaccines are enough, adequate, and readily available. Not for when a pandemic comes, then people have to first wait for 3 months for the first batch to come. I think it should be something that, let's say, rapid response. It should be there. In case of this, it should always be there. Yeah, because I think with vaccines, it is very pertinent in preventing us from getting these diseases and all.
What else would you like to see the government as well as the Ministry of Health do when it comes to ensuring that health workers are enjoying their due rights?
Oh, enjoying their due rights. Let's zero ground to zero ground to violence, let's say, at workplaces. No one will talk about how health workers are harassed at work. And this is a very big issue, because very many health workers actually face an issue of violence at work. It shouldn't be physical violence. When we talk about violence, it shouldn't particularly be physical violence, but they should have an avenue to which they report and they are listened to, because not every patient comes with good intent. Some have bad temper. Like medic will say something and the tempers will rise. So how are they protected at work? I've actually never had anyone come out to talk about how health workers are protected, something like that. Apart from their rights, how are they being protected at work when it comes to violence? Who is protecting them? And if yes, do they know the avenues to which they should report these issues in case they interface with any? Because anyone, even you are very likely to face violence at any particular place. In any particular place, sorry.
That's a very good point, and
Yeah.
it brings me to the discussion on psychological help, and something that you mentioned is retraining, and maybe something that a lot of health workers need as well is counselors to be with them, to help them, take them through, listen to them and their challenges, especially coming from what they've seen on the ground, on the field. And so that's something that maybe the Ministry of Health can put in place to ensure that psychologically we are thinking about their mental welfare and their mental health, so that they can continue to deliver these services and treat patients without having to lose their sense of self and to get depressed and suffer things like anxiety and PTSD. While speaking of that, is that's something that is prevalent when it comes to health workers today, the issue of mental illness.
Yeah, it is, especially their nature of work. They interface with so much, and we can't be sure if they have these mental breakdowns. And again, I will pose a question. When they have these mental breakdowns, who do they go to? Or it's something like you need to rest for 2 hours and come back to work. It's mental health is a very, very pertinent issue when it comes to someone's right to health, because it's the physical and mental well-being of a person. So if your mental health is not functioning very well at a particular point of time, how sure are we that this health worker is going to deliver 100% without having to have a nasty attitude towards the patients they are going to interface with? And I also think they need counseling services. They need psychosocial support, because they need someone to talk to, someone to listen to them, someone who will give them that counseling that will put them back in shape. That therapy is much needed, especially for health workers. Like any other field, they need it so much, because that will make sure that their mental well-being is at par, and it will have them ready to work again, not having to have fatigue, which will in turn lead to a breakdown. Because when it leads to a mental breakdown, then it's something else. It's bigger than the smaller issue that could actually that had started before. So I think, like you've mentioned, the psychosocial support for their mental health and well-being is very pertinent when it comes to health workers. I think the Ministry of Health should consider having free psychosocial support and counseling services for these health workers, maybe like twice a month, because of their busy schedules. Like twice a month, it would be a very good thing.
Indeed. And as we come to a close, what's your final word on health workers' rights and their enforcement?
I think health workers also need to be very much aware that they have these rights. Rights are everything, that everyone has rights, but not everyone knows that they actually have those rights. They should come out. Like the rights have stipulated here, they should always come out and know that this is a violation to my right. They should speak out and inform themselves more on their rights. I think that will make it easy for them to go through their daily busy schedules of work.
Thank you so much, Tracy Rita Achola, for taking us through the discussion of the rights as far as health workers are concerned. And thank you so much for joining us today on Issues at Hand. We'll return tomorrow. But for now, it's time for a coffee break. Although after the coffee break, can I interest you into an interesting program we have here in Church of Uganda called Family Farm? Yes, for those of you who are farmers, or if you're interested in getting into agriculture agricultural production, that is the program for you. So much insight can be found there. So at 11 a.m. make sure you are still watching Church of Uganda Family TV so that you can learn how to be a productive and fruitful farmer, since this is the year of fruitfulness. For now, when it comes to issues at hand, see you tomorrow. God richly bless you. Have a lovely day.